In the future, we really see a path where we have a much broader range of tools to fight this war. Now, Dr. Kim said in an article that published recently that you need 5 things to work your way forward. We all know that we're going to need to live with this virus, and we're going to live with it for a while to come, at least 18 months. So what the governor's team, and with the hope of our past governors and others, is we are building an extensive response and recovery plan and network. You have to be able to do the social distancing that we're doing. The things that we're doing and the additional new things we've added continue to be a very powerful weapon in stopping the spread of the virus. But you also have to do testing, and we are pushing the envelope every possible way because you have to test someone to know they have it. And then you have to do contact tracing, which means, again, those disease detectives who talk to you when you're a case and find out everyone you've been in relationship with, anywhere you've gone in the past 14 days. And then those contact tracers reach out to those people and tell them to quarantine for 14 days. And when we have enough testing, test those folks. And in doing that, you can start to snuff out what could be the spread of the virus. And additionally, you need to isolate and quarantine people. And the 5th part is you need excellent treatment. And our treatment is evolving ultimately a vaccine, but it could be an antiviral. It's new things like the plasma that we're doing when we're doing serum, where people with antibodies can be transfused into people who are sick. And so all new tools will come. So it's social distancing, contact tracing, testing, isolation and quarantine, and treatment. And what Jim Young Kim said was, hope is of little use unless it's accompanied by a bold and vigorous plan. And the governor, and what he'll be laying out for you before we get to May 1st, but in the days to come, is more and more parts of that bold and vigorous plan for Ohio. So there are going to be 2 parts to our efforts. One is this army of workforce, because the people we had who usually do contact tracing were, public health department-led epidemiologists. But because this is a global pandemic, the scope is so big, you need an army. You need 10 to 15 people per 100,000 population. And that is the army we've been building and are continuing to build. And so being able to see that outbreak, whether it's a prison, a nursing home, a community, a couple of cases that were associated anywhere, and be able to do that work is a way, that's the firefighting side of our house. When we see an outbreak expanding, that we can snuff out the fire. And we're building a command and control structure that sees all the fires in the state and moves on them. And if they don't have enough PPE or they don't have enough testing, we are moving resources so that we can quickly put out the fires of the spread of infectious disease. Ultimately, we knew that one person could give this disease to 3 people. But what we want is to ultimately have one person giving to one person, ultimately one person giving to a half a person, and less than a half. And in watching that virus spread and decreasing it, which is what social distancing did, we snuff out the fire of spread and we stop the virus from ever becoming something that takes out our hospitals. On the other side of our plan is what I'm now calling the dimmer switch. And this is everything that all of us wish for. This is where we all wish to get back out and get back to the things we're doing, whether it be work or other activities. So you got to put out your fires, and what we did getting into this was flip the light switch. But to get out of this, we have to slowly move a dimmer switch, watch a bunch of data and reaction to make sure not too many fires start happening, because every time we open up, it is guaranteed that we will increase the spread of this infection. But the question is, can we control it? And that's the dance that we will be walking. So you do a few moves. It might be in the area of business, it might be in the area of schools, it might be the area of parks, it might be in the area of what you do at a hospital. All the policies and things we've done we have to weigh risk and benefit. And what you want to do as you start back out into society is do the lowest risk things first and watch how we deal with the spread of infection. And then you dial the switch a little more and do a few more things. So in every area of our state, whether it's how we run our businesses, how we run a school, we are sitting around thinking, how do we live in this new world? How do I do a few more things but do them safely? So you have to have best practices of what safety looks like. We've seen this in essential businesses where we now have plexiglass and we now walk down aisles in the grocery store differently. And those are the kinds of new innovations that our businesses and our schools are hard at working at. How do we live with this virus in a way that we stop the spread? And at the same time, how do we do a little more all the time without creating too big a risk that really shuts us down and has us have to go all the way back down into a lockdown situation? So we've got our dimmer switch planning, and we've got our firefighter putting out fires plan, and that is the dance and the plan that the governor's team is working on. Do I wish we could just hand you a plan every day? There was no playbook for this. The whole world is figuring out this equation of the dimmer switch and the firefight put out. And I want you to know that Ohio is on the front edge of that.